Fragile individuals need more protection, making vaccinations crucial for them. This includes the elderly, transplant recipients, and those with serious health issues, as Dr. Stefano Chiaramonte, a nephrologist specializing in cardiovascular risk, explains. Individuals who are vulnerable, particularly in the cold season, must exercise greater caution to ensure their well-being.
People who are fragile are significantly more vulnerable to the impact of external agents and environmental conditions. Therefore, everything that somehow disturbs their stability can impact and cause harmful effects. We have a comprehensive understanding of the various aspects that influence our environment. This includes the fluctuations in temperature, climate, and barometric pressure, as well as shifts in food supply caused by seasonal changes and the availability of different foods in different seasons. All of these factors collectively have a significant impact on our surroundings. Individuals referred to as fragile are significantly more susceptible to these fluctuations. Thus, their fragility leads to an increased vulnerability to the detrimental impacts of diminished defenses.
Are vaccinations generally recommended for individuals?
Vaccinations are absolutely recommended, as we possess over a century of epidemiological data indicating that vaccinations serve as the primary form of prevention, even before treatment, for numerous situations of this kind. The purpose of vaccination is to replicate the harmful effects of an actual disease, but on a smaller scale. Despite this, it is still enough to stimulate the body's physiological defense responses. Ultimately, vaccination equips the body with the necessary tools to combat external agents, whether they be bacterial or viral. By doing so, the body is able to respond before any detrimental effects occur. Vaccination is a crucial method to prepare and protect the body. Thus, when the body is exposed to an illness and experiences a delayed response before effectively fighting it off, the body already possesses the necessary defense mechanisms in the case of vaccination. Consequently, the body is prepared to mount a counterattack against the invaders after getting vaccinated. This determines the remarkable results that vaccination campaigns worldwide have produced and will continue to yield results in combating the spread of various diseases, especially in the most vulnerable populations.
I was running a fever until yesterday, and I have to get vaccinated next week. Is that possible?
Recent fever should not prevent someone from getting vaccinated. However, it is currently suggested to wait a few days as a precautionary measure. It is important to note that this waiting period does not in any way affect how the body responds to the vaccine. It is not considered a risk factor or a sign of any underlying illness.
The vaccination offer concerns both COVID and the flu. What message for the vulnerable?
We encourage vulnerable individuals to resist the influence of widespread and false alarmism. Instead, we emphasize the importance of harnessing a powerful defense mechanism to protect oneself. It is crucial not to succumb to unnecessary anxiety, but rather take advantage of the strength we possess. Certainly, there are individuals who have a weaker response to vaccines, such as those taking immunosuppressive medications that inherently decrease their immune system's ability to respond. However, even in these cases, getting vaccinated is still beneficial as it triggers a defense response, although to a lesser extent. Additionally, it's important to note that vaccination is crucial for these individuals, albeit with a reduced immune response. Today, for these individuals in certain important situations, we also have monoclonal antibodies, which become an additional element, an extra weapon in the presence of severe pathologies. One crucial resource we have learned from COVID-19 is the absolute importance of monoclonal antibodies, which are now widely available. This valuable lesson has resulted in a shift in our understanding.
How to stay comfy and efficient during winter?
One key recommendation for the current season is to approach it with moderation and attentiveness, which is a common yet highly effective advice. It is crucial to stay updated on weather events, be mindful of temperature fluctuations, and maintain a healthy and balanced diet. Additionally, getting vaccinated is an important aspect to consider. Nowadays, there is an opportunity to receive a simultaneous vaccination for both influenza and COVID. Contrary to popular belief, this combination of vaccines is not contraindicated. In fact, receiving both vaccines at the same time can even enhance their individual effects. Opting for simultaneous vaccinations can, therefore, provide significant advantages. All these measures should be followed and applied diligently to ensure a safe and healthy season.